Good afternoon. I'm Dr. Vincent Rhodes, Chief Communications Officer here at Eastern Virginia Medical School. Welcome to our town hall meeting. We're going to go around our presenters and just have them introduce themselves. Why don't we start with Drs. Flenner and Connaughton.
Ron Flenner, Vice Dean for Academic Affairs.
I'm Dr. Millie Cunnercat, Associate Dean for Academic Affairs.
And Dr. Hooper, how about you next?
Hi, I'm Brooke Hooper, an Associate Dean for Clinical Education.
And Dr. Combs?
Don Combs, Vice President and Dean of the School of Health Professions.
Dr. Dempsey?
Hi, I'm Kim Dempsey. I'm the Director of the PA program.
And Ms. Brown?
I'm Deborah Brown, Director of Financial Aid.
Great. Hopefully I didn't miss anyone other than Dr. Homan, who I'll introduce in just a moment. The format for today is we'll have some brief comments from Dr. Homan, Dr. Flenner, and Dr. Combs. After those brief comments, we'll spend the majority of our time in Q&A. Please use the Q&A interface to submit your questions to us. As the questions are asked in the Q&A box, if you see something that's important or that you really want to have answered, please use the like function to upvote that. That'll help us know which questions to prioritize. We're going to do our best, but we may not get to all questions today. Any questions that we don't answer, we'll make sure are sent to the appropriate EVMS faculty or staff, and we will post answers on the COVID-19 website as soon as possible. For example, questions from last week's town hall have been posted online, and we'll do that as quickly as we can. With that, I'm going to turn it over to Dr. Homan, Dean of the School of Medicine and our President and Provost, to start with his opening comments. Dr. Homan?
Thanks, Dr. Rhodes, and thank you all for joining. I appreciate all the work that was put together to develop these town halls. I also want to thank all the students for their patience and their opportunity to be able to participate here so we can provide a better pathway for them to understand how we can help them graduate and fulfill all their requirements. As you all know, this is really unprecedented in terms of its scope, a time of historic significance. And we're not alone. I just want to let the students know that I've been on teleconference calls with all the deans of the United States once a week for 2 hours, and then ad hoc with others, sharing information. And I think EVMS has been very proactive, so I can assure you we're doing everything we can, as well as other schools nationally. But there are a lot of unanswered questions, and we want to try to answer some of the ones we can today. I also want to say thank you so much for participating in the survey, the online survey for commencement. I know it's disappointing that the commencement ceremony has to be postponed, but you can understand that that is now a standard across the United States. And we're looking to develop a virtual program for you still on May 16th. There'll be more details that'll be forthcoming. And we want to commit to you that if you have an interest in walking at a future commencement next year or in the next few years, we can also accommodate you then. So thank you for all that you've done, all of your volunteer work that you've done in this intervening time, your feedback back to the faculty so we can find ways to be able to improve the educational programs. And thank you for all the faculty members that have been involved in helping to develop new online programs, do new rotations to ensure that we can deliver the best quality educational programs we can during these challenging times. So with that background, I'd like to turn it over to Dr. Flenner to provide some overview from the School of Medicine.
So good afternoon. To echo some of the sentiments that Dr. Homan has expressed, I just want all the students to know that your team in medical education is here for you during these difficult times. We certainly appreciate the unrest and anxiety that you are experiencing. We too are sharing some of those same emotions. But at the end of the day, we're trying to keep things in perspective. We're not alone in this situation. All of our colleagues across the country are sharing the same challenges in terms of delivering the educational program. I too sometimes remind myself that this can be overwhelming, but remind myself that there are patients out there who are losing their lives and family members who are unable to see them during the last days of their lives, and that at least provides a little bit of perspective of our problems. I want everyone to know that your team here and the Office of Education is here working hard for you. We want to preserve the quality of your education that EVMS is known for, and that we are in discussions with our colleagues across the country, and we'll keep you informed as quickly as we possibly can, because we know that the uncertainty is very unsettling for you as it is for us. So again, we'll keep you informed as easily and as quickly as we have information that you will find useful. So we're here for you.
Dr. Combs, if you'd like to make a few remarks.
Sure. First of all, thank you to the students who are taking the time out of their day to join us. I can echo the sentiments expressed by Dr. Holman and Dr. Flinner. There are three values that really come to my mind. One is humility. This reminds us that there are really important things, and that sometimes important things conflict with other important things. And so what I want to be clear and want you to understand is the program directors, the faculty, myself are committed to doing everything we can to help our students graduate. For the clinical rotations, obviously there's a disruption in that, and that's beyond our control. But what we are doing is substituting experiences where we can, working with the accrediting bodies, and I just want you to know that it's very much on our minds. You're very near, those of you that are approaching graduation are very near completion of your requirements. We're going to do everything we can as quickly as we can to help you. But the big constraint is what the virus does and how we respond to it and what the impact on the clinical care system is. So I'll end just by saying we really are committed to you and to helping you finish your education. But we want to make sure that the education, even though it's the last 6 weeks, is the quality of education that you deserve. So we're here for you, just as Dr. Flinner's team and School of Health Professions. Don't hesitate to reach out to us. Thank you.
Thank you, Dr. Combs, Dr. Flinner, and Dr. Homan. We're up to about 119 attendees, and I think some folks are still joining. We had some technical difficulties on the rooms. So we do have one question in. I would let you know, please use the Q&A feature to submit your questions. I'm going to read this first question, and Dr. Homan, some of the folks that joined may have missed your introductory remarks around graduation, so you may want to repeat some of those after I ask this question. The first question is, canceling EVMS graduation is a slap in the face. We've sacrificed a lot and worked too hard to not walk across the stage as EVMS graduates. Most students will be out of the area and not be able to attend graduation in 2021. EVMS needs to postpone graduation to September or October 2020. So I think some of your introductory remarks will address that, but there may be other aspects that you want to add to that, Dr. Homan.
Well, we're disappointed, too, that the commencement ceremony has been postponed, recognizing, though, that every university, all med schools in the United States, all health professional schools have done the same. And it's all out of an abundance of caution and the public health interest for us to have social distancing and maintain the CDC guidelines. This is a historic time, and it's a very seminal time. I think it will provide a defining moment, actually, for all of our graduates and students going forward. We are trying to do that which we can to be able to meet your needs. There was a survey that was provided to the students just a week ago after the initial town hall. We received the information back from you, and we've elected to do a virtual commencement ceremony on May 16th, the day of commencement. Some other schools are doing the same. None are holding physical commencement ceremonies nationally. And then we're thinking about other options as well. One was to consider having an event at Alumni Weekend during the fall for those individuals who would like to come back, and then an open invitation for those individuals who would like to walk in a formal commencement ceremony in the coming years at the scope with other classes, either next year or in the following 3 to 5 years afterwards, if they wish to participate in the commencement ceremony, they could. So we're trying to provide as best we can the opportunities to celebrate your accomplishments, and we've taken into consideration all of your feedback on the online surveys. So you'll get more information over the coming week or two as we start to outline how this will be proceeding over the next few weeks, anticipating May 16th.
Thank you, Dr. Homan. The next question will be for one of the MD education folks. Lauren asks, for students applying to the MD program this cycle, specifically Med Masters, and are having their MCAT canceled or pushed back to late summer, are there any accommodations being made?
I can say that I'm unaware of any changes in the application cycle to date. I suspect that there may be some in the future, but Dr. Kimball in admissions has not shared any alterations in the schedule to date. Many of the national boards that administer these exams are taking everything under consideration, and I suspect that they will come out with alternative timelines, but to date, we're unaware of any changes in the time.
So our next question, Darcy asks, if the reason for cancellation of clinical rotations is the PPE shortage, does that mean that we can expect rotations to resume if PPE supplies are replenished? And I would assume that question is either for Dr. Flenner and or Dr. Homan.
Let me comment on that from the national standpoint first, because this has been a discussion of all the deans of medicine and presidents of health sciences nationally. We have a duty to provide educational programs for our students, but we also have a duty for them to be in a safe environment. We feel as if we want to ensure that we provide the best educational program, but in a setting where we can minimize any health risks to you. The physicians, residents, faculty members have all licenses, and they have joined together with all the health professionals, the PAs, the surgical assistants, and all those faculty members to practice. But students are in a different category. And so as the virus and the epidemic starts to subside in the coming weeks, hopefully, we'll have more clarity in terms of what the standards will be. The AAMC and all the deans are trying to identify ways to have more standard guidelines for all the medical schools, so not one school is advantaged or disadvantaged compared to any others. And I know the health professional schools are doing the same. So I wish I could tell you the time or timeline for developing the clinical rotations, but that will be out of my control and dependent on how this epidemic unwinds and how it starts to mitigate and when we can safely have you start your clinical rotations. We'll do it as soon as possible, and we'll do it based on the national standards across academic health professional schools and medical schools nationally.
Dr. Flenner, did you have anything you wanted to add? Or
I can just say for the School of Medicine, we are following the guidelines and recommendations of the LCME in terms of involvement of students with direct patient care, and that is published weekly, and the most recent publication or guidelines suggest that students not be involved with direct patient care. It's unrelated to the PPE situations at the hospitals.
MJ asks, what is the reasoning behind having the library and schools still open and staffed? Why are we continuing to put staff and their families at risk? I realize they cannot work from home, but shouldn't they be receiving their salary to stay home?
Yes, and we've had discussions of this almost every day. We have many teleconferences with leadership across the EVMS enterprises, education, clinical, administrative, and research. And at this point, it's a public library. We think that the students are requesting this for study space. We have the security and police officers there making sure that there's appropriate social distancing. And we're going to be making decisions prospectively over the next few days and week to determine whether we will continue that or whether we may need to wind that down. Right now, we've elected to lock all the doors around the library entrances in order to only allow card entrance for individuals from EVMS to be able to gain entry to the library. So the public is not now invited essentially to the library, even though it's a public library. So this is an issue that's hot on our list, and yet out of some concerns that the students are requesting the study space there at this point, we've elected to keep it open, but that's may be fluid and the decision may change over the coming days and week.
Marissa Gubler asks, if you can have an alumni party in September or October 2020, why can you not postpone EVMS graduation to September or October 2020?
What we've tried to do is to try to receive your feedback. And there'll be a number, as you know, we have a large class of physician assistants, medical students, the MPH students, and many of them will be employed on residencies around the country. And it may be difficult to be able to have them invited back at the time in a short period of time in September. It's hard to plan even for that date at this point because we don't know the unwinding and the mitigation of the epidemic to date. So we are right now planning on that which I outlined before as our best options to offer the students, and we can be open to more suggestions in the future as well. But right now we're in the process of rolling out a virtual commencement ceremony on May 16th and then providing opportunities for students to return to walk on the stage next year and the following year. We don't have the capability of renting that venue. There are other athletic activities at the scope. It's very difficult logistically to be able to allow us to do so. So maybe Dr. Rhodes, if you can add, because you've been involved in these discussions as well, any other details?
Sure. A lot of staff have been working on ways, thinking about options, and most importantly, listening to the survey results. But the last couple things that Dr. Homan hit on are also some limiting factors. Scope isn't necessarily available. The costs involved with that are exponentially higher than adding to a ceremony we have next year or attempting to do something virtually. And staff-wise, there are a lot of things that are going on in the fall in terms of orientations and those kinds of things and getting the school year started that just from a staffing perspective makes it incredibly difficult to do. It's one of our favorite things to do every year, speaking on behalf of my team, and I don't think I'm speaking out of turn for the special events folks. We love doing graduation and being with you all for that, and nothing would make us happier than being able to do it. It just isn't something that you can just pick up and move to another date on the calendar. It is just almost an impossible task to do that. So we appreciate your concern and are doing the best that we can. And just keep in mind, again, you're not alone in this. People across the country are experiencing the same thing. So we'll go to our next question. This is from an NPA. Some of our professors have not checked in at all with us and are just using last year's lectures. Do you agree that our tuition should reflect the education we're receiving right now? I feel like it is possible to use other resources like Blackboard Collaborate in order to check in with us. And I think that would be a question for Dr. Combs and for Dr. Dempsey.
I think Dr. Dempsey is in the best position to answer that. I will say, again, we are committed to doing the very best that we can. We've had to, in very short order, take a whole bunch of courses that were delivered differently and try to move them online. And so all I can tell you is that from my perspective, we're continuing to work the problem as best we can. But Dr. Dempsey can give you some more details.
Definitely. I will speak to the use of lectures from last year, and for the most part, that's really impacting our clinical medicine course that has a lot of guest lectures that come in every year and speak because they're from that specialty of medicine. They are typically the same guest lectures that we use every year in that course. So you're getting last year's lecture, but it would have been the same lecture that you've gotten this year. Course directors are continuing to check in, send emails, whether it's through Outlook or through the Blackboard system, but they are continuing to check in with students. The majority of our classes are creating lectures and recording them this year new, but our clinical medicine course, yes, has definitely had to use some lectures from last year due to the guest lecturer content.
Thanks so much, Dr. Dempsey and Dr. Combs. Kayla asks, for M2 students transitioning to M3, if clinical rotations are delayed, how will this impact disbursement of financial aid? I think that's either for Dr. Flenner or for Ms. Brown.
Currently, there's not going to be a delay in financial aid until we get some additional guidance from the Department of Education. We're going to proceed as scheduled with disbursements. long as students are enrolled in classes and are enrolled at least half-time, funds will disperse.
Thank you very much. Karen W. asks, will our upcoming semester for MPA Summer 2020 occur on a schedule, or will it continue to be self-paced? Dr. Dempsey?
We're going to continue with the same format we have now. You've already received your summer 2020 schedule, and we gave it to you as if we were face-to-face, but some courses will have some synchronous activities. Most of it will be asynchronous. We realize the demand that you have on you now with family members. A lot of you have children at home during this time that you're caring for, so we've tried to keep the synchronous activities to a minimum and when they are needed. But it will be mostly asynchronous and self-directed. Your faculty are always here, though, to check in with. We constantly monitor our email communications.
Thank you, Dr. Dempsey. I apologize for the pronunciation on this if I mess it up. Imidol asks, assuming that a portion of our tuition is used in the funding of class events, graduation, etc., are there any plans on reimbursing students a portion of their tuition, given that all of these events are now canceled and that a lot of class funds will largely go unused?
We're looking at that, and we certainly want to provide the fees for commencement back to the students. So we had a discussion from the team just this past Tuesday night, and we're looking to find ways to be able to have that disbursement go back. It's not clear whether that can go directly back to the student or it has to go through some vehicle through financial aid, but we're going to commit to doing that because the students can't attend commencement this year.
Thank you, sir. So MR asks, speaking to keeping programs equal, the PA class of 2020 has been told that about half of our class has been given the opportunity to graduate on time, and the other half of us are required to wait. Please speak to how this decision is fair and does not disadvantage those not graduating on time. Dr. Combs or Dr. Dempsey?
Yeah, I'll take the first crack at that. I understand the question. It is purely a function when our board or any board across the country approves students for graduation, they do it based on the assumption that all of the degree requirements are completed. And we're required by our accrediting bodies to make sure that every student in a program completes all the requirements. In the case of the PA program, about half of the students in structuring their rotations ended up with an elective at the end, and we were able to put together an online course for those, and so those students will in fact have completed their graduation requirements. There are another set of about half of the class that have not completed their graduation requirements, and they won't be able to until we're able to re-enter the clinical setting. And so that's purely a function of how their particular course sequence was scheduled, and at the end of the day, it's the luck of the draw. Nobody could be anticipating this virus impacting us in March of 2020. So the judgment is if students have completed their requirements, they are entitled to graduate, and we're going to do that. If they haven't, we're going to do everything we can to expedite the completion of those requirements, but we cannot certify them for graduation until the requirements are met. Dr. Dempsey, you want to add anything to that or talk about what you're trying to do for the half that still have clinical obligation?
Absolutely. One of the things that we're constantly doing is keeping up with our accrediting body and looking for guidance from them and how to get through this difficult time. And they just recently sent an update to us and have given us some guidance regarding meeting the clinical education requirements for those students that don't have the elective as their last rotation. Right now, your clinical team is conducting a gap analysis. They are looking at the clinical requirements that are required and see if anywhere during your clinical year you have met those minimum clinical requirements for whatever your last rotation is. Each rotation has different learning outcomes that we have to meet. So we're undergoing that analysis now to see if there are any further students that we'll be able to certify for graduation. Now, if we're able to meet those clinical requirements, we still are going to have you do the directed assignments and the virtual learning that are going to go along with that clinical rotation. So there will be more work to do to be able to meet all the learning outcomes, but we are looking to see if we can expedite those, at least a few more people so that they can graduate on time.
Thank you. Chelsea Kaufman comments, as someone studying and applying for jobs without a printer or scanner at home, please keep the computer lab open. So that was a comment more than a question. MJ asks, shouldn't students be staying at home? The state is mandated to shelter in place and only leave for essential services. As much as the library/campus is a nice place to study, it seems irresponsible to disregard state guidelines and continue to put people at risk on a medical campus. Who would like to field that one?
I'll take that again. We've discussed this with our attorneys, general counsel, and what are essential services and non-essential, and what is applied to higher education. As I mentioned before, we're going to be looking at this on a day-by-day, week-by-week basis. It was elected, at least in the interim time, to secure the perimeter of the building, only allow card access, have the police and security people, and make sure that there is physical distancing among students. And we will make an assessment as to whether we want to maintain the library going forward. It's only really used now as study space, and as the use of that drops, we may have a decision made in the next week or so to wind that down. But we do have the capability of doing this. I just want to let the students know. We are not abrogating the governor's order. We've had our attorneys identify that we are able to do so. It's our judgment to allow the students to have some study space, and we're electing to do that at this time, but we may elect to rescind that in the coming days and week.
Thank you, Dr. Homan. Student 8 asks, are your decisions more so based on national and or federal guidelines, stats, etc., or on the state? Is there any word on how institutions in different states with different numbers will be compared to each other fairly? Sorry, I'm not too well versed on politics, so it might be a silly question. Doesn't sound like a silly question.
No, it's not nothing. So I'll take that as well. I'd frame that in terms of we are looking at this first from the public health standpoint, from the CDC guidelines, that which we need to do from the public health standpoint. The second is based on the accrediting agencies of the respective programs. And the third is based on the normative behavior and opinions of all the presidents and deans across the academic health centers across the country. And I'm participating in those conversations every week. And through those conversations, out come recommendations, national recommendations from the accrediting body. So in medicine, the accrediting body that accredits medical schools is the LCME. They came out with guidelines outlining clinical rotations and that the students should not be on clinical rotations. Number two is the residency programs are governed by the ACGME, and they've come out with recommendations as well. So it's not state by state or federal in terms of government. It's the academic governance nationally and the wisdom of that group that we're utilizing as the guideposts for us to continue. And I've looked at other questions. Let me just respond to one as well. So for instance, there's been a lot of conversation related to the MD students graduating early. And there has been some publicity around that, thinking we could add to the healthcare workforce in areas where it's needed. We had a long discussion of other deans in the country. They are graduating students early in New York, and they may do it in Louisiana because of the needs there. But they're not starting their residency program right away. They're being identified as assistant physicians just to do H&Ps, where they have an MD, but they do not start their clock, nor do they receive credit for residency education. The ACGME, the governing agency for residency programs, came out advising most schools to avoid that, as well as the LCME, the accrediting agency for medical schools. And so I know Dr. Flenner and I have had a long discussion around this. And my personal feeling is that we can't compel any students to be able to graduate early and then be put in the workforce. Number two is that we have an obligation to make sure that all of our students graduate first, and that's our first priority and get all the requirements done. And other states may have or other institutions may have an interest in doing it based on acute workforce needs. There is not one right now. If there were one locally, we would consider it. The only schools that are doing this now are for medical graduates of the school that are going into their own residency programs. You can't compel a student going to another residency program outside the state to start early. But it's on a very limited basis and only in the areas where the crisis of healthcare delivery is very, very limited. So Dr. Flanner, maybe you can provide your opinion as well.
Sure. Just to echo what you said, the ACGME is not endorsing early graduations for students, nor do I think it's a good idea. There's obviously a structured onboarding process that exists in residency programs, and averting that, I think, is not the proper way to go. So I don't have much of an appetite personally for students to graduate early to enter the workforce without the proper onboarding and training and orientation they need to be successful as a resident. And I don't know if Dr. Hooper has any additional comments or not.
She's shaking her head no. Okay, so we'll move on to the next question. This is from an MPA 2020 who asks, there's been no discussion about the PA white coat ceremony. Can this event be postponed to take place fall 2020? Dr. Combs or Dr. Dempsey?
I think that there simply isn't the capability to do big ceremonies like that in the fall for the same reasons of commencement. We fill up a big room when we do that, and it's a great loss to us. But unfortunately, this is a once-in-a-lifetime event, and it's hitting right now. And so we are going to do the best we can in terms of a commencement ceremony this year, but all of our programs all of our clinical programs in the School of Health Professions have a white coat ceremony of some sort, and unfortunately this year we're just not going to be able to pull it off.
Thank you. Just as a reminder, if you have questions, please submit those in the question and answer chat interface. And if you see a question that you think is particularly important, feel free to use the like feature to upvote that. The next is also from an MPA, and they ask, do we have any updates on the status of the MPA student that had the confirmed case of COVID-19? Dr. Dempsey?
I've been in touch with that student periodically, and the student is improving well and participating in coursework.
That's good news. Thanks so much for sharing that. And thank you for asking, to the student that asked. Another MD 2020 asks, will there be any issues for M4 students getting credit for rotations half completed in Block 9?
I can speak to that one. So yes, some of our rotations for our graduating fourth year medical students were cut short. Some were converted to 2-week rotations. We have looked through all of our requirements, and we have put into place some measures in order to continue to complete the requirement for acting internship if you missed 2 weeks of that, and critical care rotation if you missed 2 weeks of that. These are going to be online modules where you will complete either a critical care course through the Society of Critical Care Medicine and receive a certificate at the end, or you will complete a set of modules that's been created for fourth year students to onboard them into residency that's called WISE on Call. So with the completion of either of those, depending on which requirement wasn't met, you will receive a grade for those rotations and credit for the full completion of the course. For the ambulatory rotation requirement, we have reduced that to only needing to have 2 weeks completed in order to graduate, because we have a significant number of ambulatory weeks during our clerkship year that met that objective. The remainder of the electives going along with LCME guidance, we are going to waive as needing to be required for graduation. So as long as you have completed the acting internship, the critical care rotation, and the 2 weeks of ambulatory credit, then you will be on track to graduate. And we'll be in touch by the end of this week with all of the students that are affected by this individually to talk to you about what your plan will be to stay on track.
Thank you, Dr. Hooper. The next question is, aside from one EVMS PA student, have there been any other confirmed COVID-19 cases in the EVMS student body? Dr. Homan?
I have to say I don't know. I don't believe so. maybe Dr. Combs would have information, or Dr. Flenner. I know we've had many exposures for the residency, some faculty members, they've been in quarantine. The individual PA student that exposed classmates, from my understanding, did not infect anyone else, from my understanding. But maybe Dr. Combs and Dr. Flenner can speak more specifically without naming names.
Yeah, Dr. Holman, I only know of one other case that was an art therapy and counseling student who has not been on campus during the month of March, but was tested and has recovered. It was an early March exposure for her. She did have some incidental contact with friends, but it was distant contact, and I'm not aware of any spread from her either. So those two students, one PA and one art therapy and counseling, are the only two I'm aware of, and both have recovered.
Dr. Flenner, did you have anything to add? Or
I'm personally unaware of any MD student who has a confirmed diagnosis of COVID-19.
Okay, thank you very much. Janal asks, as the MPA class of 2021 is preparing for clinical rotations, could you speak on what the replacement elective course will consist of? Also, because this new course is added in order to have us graduate on time, will students be eligible to complete an elective rotation after walking for graduation? Dr. Dempsey or Dr. Combs?
What we've done is we've taken one of two clinical electives for the class of 2021 and created an online elective course that's going to replace that one. The online elective course is currently being developed. The syllabus is being developed as we speak, and we'll go through the curriculum committee, but it's going to contain a lot of preclinical education, some online virtual education that will help you be successful in your clinical rotation. So you will still have an elective rotation that you can do. You don't have to do that after graduation. You will have that as part of your regular clinical rotations.
Thank you, Dr. Dempsey. Leslie Waller asks, for the PA students, the plan is to up one of our rotation electives. This is an opportunity to explore possibly specialty career choices. A few of us were thinking about having 4 or 4.5 week rotations. Maybe we could choose which option we prefer. Dr. Dempsey?
The clinical year team is currently working on a plan so that we can get your class through clinical rotations and be completed on time so that there's not any extra time. One of the things we are looking at is the length of the rotations, but we have to make sure that the overarching thing is that we can meet the competencies, the outcomes that the clinical education year requires. So we are looking at all options.
Great, thank you very much. Julie asks, since part of our tuition pays for attendings and other physicians to teach who are now full-time at Centera and receiving bailout funding, has there been any discussion to refund part of the tuition for M3s, second-year PAs, and SAs whose education is primarily based on clinical experience?
Sure, well, I can speak to that. Right now, it's not clear what funding will be available for any attendings here or whether any funding will come to EVMS. We're a public institution. We don't get tax credits. The funding, from my understanding, talking to peers nationally, is that the money's likely to go through the academic medical centers, through the hospitals, and through hospitals nationally. But you have to understand that the funding that is being provided will not at all cover the loss of revenue that's been incurred across the country from the decrease in elective surgeries, from the decreased utilization, from the movement from person-to-person contact with clinicians and their patients to telehealth. This is creating not only an educational crisis and challenge nationally, but it's also a financial challenge nationally as well. So our faculty continue to teach, the volunteer faculty continue to teach. The residency programs, they're also involved in the online and the virtual training. And so we are trying to, in some way, we're creating the future of academic medicine and the delivery of health professional medicine by doing this now. So we at this point, I've not had any discussions related to rebating any tuition to individual students at this point. The costs to continue to accrue to the school based on the decreased revenue, because we receive about 30 to 40% of our revenue through our practice plan, and we only get about 8 to 9% of our funding through the state. So we're working through that, and we're working as best we can, recognizing that this just occurred 4 weeks ago from a standing start, to go from personal instruction to now online, virtual, and identifying ways to be able to get all of you a quality experience that you can fulfill all your requirements and graduate. So Dr. Hooper, Dr. Flenner, I'd like you maybe to make some comments too, and then Dr. Combs.
Dr. Hooper?
Sure. So I can speak for the clerkship faculty and also the fourth year faculty and myself, as we have been not only participating in more clinical work, but also putting all of what we can online in the most meaningful way and the most high quality delivery of online content for you related to the clerkship. We have a lot of faculty and residents and your clerkship directors and fourth year course directors who have been contributing to the development of these courses and will be contributing to the delivery maybe in a new format via telehealth or telemedicine or lectures that are provided virtually or online, but still are very committed to continuing to share our knowledge and continuing to train the next generation of doctors that are going to be joining us very soon.
Dr. Combs?
Yeah, I think I certainly understand the question. I think that the reality is, as Dr. Homan said, our costs continue and in fact are shifted to deliver education. We may have different people who are able to do it, and they're delivering that education. And we're balancing, trying to ensure that the graduation competencies that we've identified as essential are fulfilled. And we're going to do that as quickly as we can. And so people are going to be teaching in June and July, and those costs have to be covered. And so we're looking at the end of the day, we're trying to get everybody to complete a quality education and to complete it as close to on time as possible. And we're using all the faculty resources we have to make that happen.
Thank you, Dr. Combs. Our next question is from Dana. Thank you for your transparency and for hosting this session. How is all of this affecting EVMS's ongoing LCME accreditation? Dr. Flenner?
Sure, happy to answer that, Dana. So we are continuing along our timeline, the trajectory we have in place for the LCME reaccreditation. You probably know that we have a survey team visit scheduled for October of this year, and our submission is due in July for all of our data collection instrument and all of the materials that they are going to review prior to the on-site visit. We have been in contact with the LCME regularly, with the Secretariat, who fortunately visited this institution prior to COVID and is familiar with the environment here and the faculty and our structure. And so we regularly are in contact with her, and we also continue to remain in contact with our consultants. As a matter of fact, we have 2 calls scheduled for next week. So we are working under the assumption that our materials will be due in July, and the visit will occur in October until we are identified otherwise. But we've received reassurance from the consultant, as well as more importantly, the LCME, that they are going to provide some latitude, obviously recognizing that all schools are struggling with the same challenges for clinical experiences. For example, assessments not being able to be administered as they historically have been. So we are in contact with the LCME, as I said, and to ensure that we are remaining compliant with all of the standards.
I just want to make a comment as well. As you may know, we're a health sciences university because we have a School of Health Professions and a School of Medicine. So we're required to become accredited through the Southern Association of Colleges and Schools, SACS accreditation. They were actually supposed to be on campus today to do the on-site visit, and they've postpone that until February. I believe it's February 19th or so. And we are on track for the accreditation. That's the overarching accreditation for our institution. The LCME that Dr. Flenner mentioned is specifically just for the School of Medicine, the educational program in the School of Medicine. So I want to assure the students that we're proceeding on target. I don't have any concerns about any real significant issues related to either accreditation process. We've done a lot of work on this. Dr. Flenner and his team have done a great job on LCME. We worked with Dr. Combs, Dr. Malona with the SACS accreditation. And so I want to ensure the students that, there's not going to be any concern related to accreditation because we've been managing that actively. And the SACS accreditation, at their request, will occur next February.
This question is from Surya and is, I believe, for Dr. Knight. Are there opportunities that EVMS has identified for students to get involved in the situation in Hampton Roads and Norfolk area?
Hey everyone, absolutely. So your SGA leadership, as always, has been remarkable through this situation. And if you go per my email yesterday and through a lot of the postings they've been putting on your Facebook class groups, if you go to Event Medley, they've redesigned that entire website to share the opportunities that students are spearheading to contribute on a volunteer basis to the response. We're wanting to do this in a very thoughtful, planned way for your safety and for your productivity, and to make sure we're not overtaxing already taxed, organizations and healthcare systems. But you guys can have a remarkable role in this, and I really encourage you to check out Event Medley because there's already a lot happening, and that will continue to grow as is appropriate. And always feel free to email me if you have any questions.
Thank you, Dr. Knight. The next question is from MJ, who asks, it seems likely there will be multiple waves of community spread until a vaccine is approved for use. Assuming widespread testing, including antibody titers, become available, will students be required to prove immunity before school resumes in the fall?
I can answer that. I think the simple answer is no. And it's a great question. A lot of unknowns there. As you know, that the entire population is naive to this virus. And so that's the reason why there have been waves of epidemics in certain areas. I've been in contact with colleagues of mine in New York and Philadelphia, Seattle, New Orleans, and it is very, very, very difficult there. The spread is coming here. It will not spare any community in the United States. As you know, you've probably seen Dr. Fauci and Birx on TV. Dr. Fauci is the world expert in public health and infectious disease worldwide, and the vaccine is not likely to be available for probably 12 months, even though they fast-tracked it. My understanding is that they are now in phase 1. If it goes through phase 1, which is safety, to phase 2, they may ramp up production of millions of doses in the event it actually is safe and effective. They don't have to wait for efficacy trials to come out, and they will actually have an inventory of active virus that may be effective. Notwithstanding, that's going to take probably 12 months. So you're correct in the sense that this is likely to occur in waves. We'll have to adhere to the CDC guidelines. There are more and more discussions about masking the population because there's been some anecdotal evidence of virus shedding among asymptomatic patients, even with exhalation in rooms that may aerosolize the virus. And the thought is that perhaps over time, once we have enough masks for health professionals, it may be more customary for that to occur until everyone has either natural immunity or from a vaccine. There have been efforts to determine whether IgM and IgG antibodies are protective. It's not clear as to whether they are at this point, although there was one study that came out from Sichuan, China, just this past weekend in JAMA that indicated that they were using convalescent plasma in 5 patients. And that's from antibodies from patients that actually recovered. And then they administer that to very sick, diseased individuals. And there was partial effect and some recovery in those 5. 3 of those 5 patients actually had a dramatic benefit. So the thought is natural immunity probably will work, hoping that the virus doesn't mutate and then have another antigen that may perhaps we need to get exposed to and become and which would be antigenic and then have to have another immunologic response. So the short answer is we're not going to require proven immunity. I think in the coming year, we're all going to have to continue to be very vigilant in terms of social distancing. There may be requirements for masking. We'll make the vaccines available when they are. We may have opportunities to have the antibodies, the IgM and IgG antibody testing available maybe in the fall to give students and faculty and maybe community members even some assurance that they may have some protection. But until the herd population is immune, maybe to 60%, we're still going to have some waves in the future. So that's all I know right now. That's based on very limited data and anecdotal reports from other academic health centers and the limited literature reviews, and that which comes out on a daily and hourly basis, trying to find ways to be able to mitigate this. So even though you are graduating, please maintain the adherence to the CDC guidelines for as long as they are posted.
Thank you, Dr. Homan. We have several more questions, and we're down to about 30 minutes left. So Michael Corbin asks, are plans in place for rotations, residency interviews, and completing requirements in anticipation that this virus has another possible wave in the fall with no vaccine? Dr. Flenner?
Sure, happy to answer that. The National Resident Matching Program published a statement yesterday that actually addresses that very question, stating that they are aware of the issues logistically that are resulting from this viral pandemic and the need to take that into consideration for rethinking the timeline for away rotations, applications for residency, and the actual match date, not only for residents but for fellowships as well. The statement basically includes their consideration of these factors, but no definitive decision as to whether or not the timelines will be changed. My suspect is that they will, and future publications indicate that they are definitely going to change that, I hope, because at least now they're recognizing that they're really fully aware of the significant implications that this is having on the timeline that we normally adhere to for applying and matching. So more to come from the NRMP.
Thank you, Dr. Flenner, and I think this next question will be for you as well. Max asks, for MD graduates that are expected to start internships here at EVMS or Sentara Norfolk General Hospital, are there any updates for those of us possibly starting early? You addressed some of this earlier, but I think this one was specific about folks staying here.
So I think Dr. Homan addressed that earlier, a similar question, and at this time there are no plans for EVMS fourth years to graduate early or begin their residencies early. And in a conversation with Dr. Archer, my counterpart in the graduate medical education world today, actually also shares that view that early graduation does not seem like a very viable option for any students, including those here at EVMS who are to begin their residencies at a EVMS residency.
Thank you very much. Catherine Schaefer asks, in regards to telehealth for M3 students or student involvement, is there a way to have us integrated with CEL community populations? Med Spanish, Hopes, and Street Health are looking for ways to reach out to the vulnerable communities.
Dr. Knight may be able to respond to that.
I'm not sure I can. I will do my best. I know that there are each of those groups are actively working with their faculty advisors to try to determine what is possible. And in terms of telehealth, I think that's still in its infancy with student training. So we're just going to have to take it one step at a time. But it is very much on the forefront of those organizations and their faculty advisors.
Thanks so much for answering that. Student 1 asks, as this pandemic proves that much of medical education for MD students can take place entirely online, will this affect how the preclinical curriculum is run during the first 2 years? Someone from MedEd, I guess, would feel that way.
Yeah, so this is Dr. Kunderkat. So I think it's a very perfectly worded question, and I think we're all thinking the same thing, that not just clinically, but also from a medical education standpoint, this pandemic will change medical education forever. So For the short period of time, we're looking kind of in cycles. So for the end of this academic year, we're looking to run out this semester. In the M1 year, that means the last module, GI and metabolism. Once we work through that, then obviously we're already thinking and planning for next academic year. But part of our contingency plan is also thinking about next academic year, and if this pandemic moves forward or has subsequent waves, that we'll be prepared to deliver the curriculum online into next semester if needed.
Thank you. Julie asks, since we've not done any online modules or received any education over the past 3 to 4 weeks, will there be any tuition reimbursement for this time? Can this be at a minimum considered? I appreciate your time and thank you for hosting. Please stay safe and healthy. Dr. Combs or Dr. Homan?
Not sure what program they're talking about, but to the best of my knowledge, everything that is didactic has been moved online and is ongoing. Now, again, we're toward the end of the semester, and not every curriculum has 3 credit hours as its basic unit. They vary from 1 to 2 to 3, but to the best of my knowledge, all of the courses that need to be delivered are being delivered, and the tuition payments obviously are for the delivery of those courses.
Okay, thank you. Dr. Homan or Dr. Flannery, anything to add, or should we move on? Okay,
Nothing to add.
on. Matthew asks, are there any opportunities for students with prior healthcare experience and current licenses/credentials in other allied health fields to assist with the local response, should that become necessary? Can EVMS play a role in connecting those of us who want to help in those roles?
Allison, I think maybe you could just provide an overview for students may be differentially aware of what you've set up and how to access it so that they could be helpful.
Sure. Again, what we're looking at with the volunteer experiences right now are for do not involve direct patient care, but there are a lot of opportunities, and one of which I'd like to highlight is the Virginia Medical Reserve Corps, which is organized through the state government, and they are looking for volunteers of various levels of training and experience, and so that might be a good outlet for people to consider. I'm looking at the question right now to see if I'm answering it. I think probably that would be the best place to start.
I think so. Thank you. Student 4 asks, will Step 1 scores be considered for AOA eligibility, given that there are less objective measures available now that rotations have been cut short?
Maybe Dr. Flannery can talk to, and Dr. Kennicott, because the students have been the ones actively engaged in that process, and it's not based on scores per se. So Dr. Kennicott, if you can give the details.
Sure. So there's both junior AOA and senior AOA. For both junior AOA and senior AOA, the clerkship year actually does contribute for the first 6 blocks of the third year junior AOA. Would take that into account, and for senior AOA, it will take into account the entire third year. AOA is grades and clinical performance, but it's also kind of the humility to serve, the professionalism, other kind of core attributes of medicine. So we can definitely collectively look at that, but at this time, Step 1 is not part of the criteria.
Thank you, Dr. Kennicott. Mihir Karande asks, this might be a hard question to answer, but could the start dates of the next academic year be impacted by the virus?
I'd answer that in terms of yes, there's always a chance it could. Right now, we're still planning on the current calendar and trying to do that which we can do for the current students, and ensuring that we can get those that are just impending graduation to get fulfill their requirements. So, but there are issues out of our control related to how extensive the pandemic becomes in this region around the country. So we're going to have to assess that prospectively and make the best decisions we can in the interest of safety, but also in the interest of your educational experiences.
Thank you, Dr. Homan. Student 1 asks, will the school be looking into a virtual induction ceremony for GHHS, I think that's the Gold Humanism Honor Society, and AOA?
I can jump in.
Dr. Knight?
Yeah, I'm along with Dr. Suhair Humadi, the faculty advisors for GHHS, so I can speak to that. GHHS is a little bit different than AOA in that the new inductees are a member of the MD21 class, and so they will still be on campus with us for a while, or in the program for a while. So we are hoping at some point when things settle down in terms of the virus spread and the impact on our region to look to actually host an in-person event. It is a very meaningful and important part of the year for all of us. If that's not possible, we will absolutely do a virtual event because this is your recognition into this of this honor is very important. But we're kind of waiting to see right now to see how things play out, but we will definitely be communicating as we move forward.
Thank you, Dr. Knight. A MedMasters 2020 student asks, has there been any discussion on changing the medical master's curriculum for this last module in terms of grading, i.e. graded versus pass-fail, or what are the thoughts on how grades might be impacted?
I would encourage you to talk with Dr. Damon about that. I know there have been some discussions. There are pluses and minuses of going to pass-fail, particularly when you're in a program like the Medical Masters, applying to medical school and their evaluation of pass-fail. But she's the one who is leading that discussion, and I encourage you to reach out to her.
Dr. Combs? Kayla asks, regardless of what Prometric centers or USMLE allow, as an institution, is it prudent to have students take step 1 before the COVID-19 pandemic is over? Death tolls are estimated to be at 200,000 plus by the end of summer. How can students be asked to perform in the midst of extraordinary crisis? Dr. Flenner or Dr. Connercott or Hooper or Dr. Homan?
Thanks for your question, Kayla. It's definitely a well-worded, and we hear your sentiments. I think all of us are in this process of trying to keep multiple plates spinning at one time and weighing pros and cons of multiple contingency plans, not just now, but kind of for your cohort over a 4-year period. And so we're trying to weigh the pros and cons of when to take step 1, the impact of that on 3rd year, the potential impact of trying to balance step 1 and step 2 studying and applications. And so the delay of step 1 has downstream implications, and understandably completely that this is the first hurdle that is in front of your class as far as exams go, but we're trying as best we can to balance kind of a 4-year curriculum and 4-year expectations and put you in the best position we can to be successful, not just for this exam, but also balancing all of those future competing responsibilities. Dr. Knight, do you have anything else that you would like to add?
No, I thought that was beautifully put, and I just would, reiterate. We hope to that we're gonna continue to follow all the guidelines. We're not going to put any students in any sort of danger just to take step 1. We will work individually with everybody to work on what is best for you, and every year we do that. So if there are individual cases that need unique attention, we will definitely provide that. But please know that your success on that exam is still the thing that is foremost in all of our minds of those of us that work really closely with your class.
Thanks so much. So we have one more question, and
just an editorial. I wanted to let the students. This applies also to physicians that need recertification. So, just on a personal note, I was supposed to take the geriatrics boards on Tuesday, and that was deferred. So this is a national issue that is being addressed by all the medical students. Don't feel as if you're alone and that you have any disadvantaged status based on what we're doing here. We're trying to be proactive. We're doing everything we can to ensure your educational program and allow you to be as competitive as possible. So I know Dr. Flenner and Kennercott and Dr. Combs are all working very, very hard make that happen. So I just want to give you assurances. We're not alone. You're not alone. This is occurring across the nation and across all the professional certifications, recertifications that all the physicians and health professionals take nationally.
Thank you, Dr. Homan. We have one last question and one last comment, and then we'll wrap up with some closing remarks. So Julie asks, will there be any considerations for Block 6 for M3s to be the standard honors high pass grading scale? If they do change the grading to pass-fail, how does this affect residency resumes? We completed over 4 weeks of the rotation, and it seems feasible to complete all requirements. Dr. Flenner or Connercott or Hooper?
This is Dr. Connercott. My understanding is that Dr. Hooper is, speaking of balancing responsibilities, she's actually, clinic started at 1. So I will partially answer this and then just say that there's more to come. But we've been in communication with our Medicine Education Committee. That's the committee that's in charge of our 4-year curriculum. And they're the ones that make these decisions. We've also been in contact with our registrar to try to decide to understand what are the options for being able to denote all of the changes that we are having to implement as a result of COVID-19, because we want to make sure that that your hard work and that your efforts are best reflected in your future application. And so what I would say is that there's just more to come, and we're exploring different options of how to best reflect your hard work and put you in a position to be successful in your residency application.
If I could just add, I'll be on a conference call later today where other schools will be discussing this exact issue, grading pre-COVID versus post-COVID, and what the implications of that are, and how residency programs are likely to interpret those grades prior to the epidemic, and then changes that have occurred after we've been challenged with this with the epidemic. More information will be forthcoming.
Thank you both very much. So this last is a comment that a student submitted, and it's for all of our presenters. The student says, thank you all so much for doing this town hall and answering all of our questions. Hearing the latest updates from you all is very helpful. Also, just want to give special thanks to Dr. Connercott. She's been in consistent communication with our class, and we really, really appreciate that. So thanks to all of the presenters. Hopefully we've been able to answer a considerable number of questions. Before we wrap up, I wanted to check in with Dr. Flenner or Dr. Combs to see if either of you had concluding remarks before we return it to Dr. Homan.
I can just say that our program directors and faculty are all committed to doing everything we can in balancing ensuring a quality education and a timely completion of requirements. We understand all the difficulties, both for the current class and the concern about upcoming classes, and we're working every day to make as much progress as we can.
And I would just like to add that I am incredibly fortunate to work with an amazing team who all have your best interests at heart, including Dr. Connercott, who's already been mentioned, Dr. Hooper and her amazing work, and Dr. Knight, amongst others, who work tirelessly to ensure that you all are successful in the face of this unprecedented, challenging time in which we are existing. But I have a fantastic team, and we're all here to provide support to students to the best of our ability.
Before we conclude, there was one final question that came in, and I don't know that we have an answer specifically, but a good suggestion. Tiffany Cambron asks, can we have a session similar to this with our specific program director / faculty and class? And so great suggestion, and I'm sure Dr. Combs will take that back to his program directors, and we'll see what we can do and get back to you. Dr. Homan, would you like to wrap up?
I want to thank the students for participating. We want to communicate as often as we can with all of our stakeholders in the school, our faculty members, community faculty, educators, the students that we serve, the residents, and these are important for us. So please let us know if you want us to continue to do this on a regular basis, because I feel this is very important. I want to let you know, too, that as much of this crisis has occurred just in the last month, I know other schools around the country, and I think the students are fortunate here that we're a focused educational institution. That's what we do best. And a lot of other deans and presidents around the country are not focused on the educational enterprise like we are. They're focused on their research enterprise, somewhat on their clinical enterprise as well. And in some ways, we are in a position to weather this better than most because our faculty are enormously committed to delivering high quality education. That's what this school is known for nationally. And so I want to give assurances to the students that we're going to continue in that mode, and our faculty are going to continue to be absolutely dedicated to provide the best educational program that we can to ensure that you can graduate on time, be a successful professional, resident, or whichever, or scientist, or whatever cell line essentially you differentiate into. So please bear with us. This is unprecedented. Communicate with us. Let us know if you'd like to have another one of these meetings in the coming weeks. I'm going to have another one of these with the faculty and staff next week. And if we need to do this on alternate weeks with the students, be happy to do it. So please give us guidance in terms of how we can provide better feedback for you as we walk through these uncharted waters. Thanks for all the faculty and for the students as well.
Thank you, Dr. Homan, and we'll conclude with one last comment that came in from a student. Tamana Sani, and I again apologize if I pronounced it incorrectly, commented, "Thank you to all the deans for their transparency. You're in uncharted waters just like we are, but I know you're still keeping us in mind. The match day drive-thru was a prime example of that. We appreciate it, and please stay safe." And with that, we thank all of the students that joined us today. We hope everyone will stay safe and healthy, and thank you so much. This recording will be available afterwards, so if you have fellow students who were not able to see this, please point them to the website. We'll post a link. Thank you to all of our presenters, and thank you to you. And this will conclude our town hall.